Welcome to the After Spin, opinions from thought leaders in our state. I want to ask Donna Martinez and Dennis Wicker. We talk a lot about those who've been damaged from the coronavirus, but a survey by the North Carolina Academy of Family Physicians, which, by the way, is an NC Spin sponsor, and by the North Carolina Pediatric Association, is frightening. 87% of the practices report being under significant or extreme financial pressure. 92% of the physician-owned practices are threatened to survive. Medicaid and Medicare reimburses them for patient visits less than do commercial insurance plan. Does our state need to step in and help provide for these family physicians and all physicians for that matter? Dennis?
Tom, my answer would be yes. These are our frontline healthcare providers. What's going to happen to people who are sick when we have none of them around because they're broke? If we can give money, the government, to billion-dollar corporations for payroll, certainly we can find the money to help subsidize somehow these doctors who are providing the health care to our people in this country so they can stay in business. This pandemic has wreaked havoc on their practices, and we need to step in and make sure that they survive it so that they can take care of the sick people that are yet to come.
Donna, some of these people got those PPP loans, but the money's run out, and particularly for people who are in rural areas. Some counties only have one or two doctors in the counties. Should the state step in and help here?
No, they're small businesses, and as you said, some already got the PPP loans. So sadly, they are like a number of other industries, and some of them are going to go under, and that is heartbreaking. That's part of the COVID-19 story. But more public money really isn't the answer. What's going to happen is that some of them may actually be bought by hospital systems. So you're going to have less and less options, less and less opportunity, and that is not a good signal for prices. But for those that do stay in business, Tom, here's the prospect they're facing. Depending on what happens with the November elections, if you have Joe Biden, for example, elected, what you're going to see is a push with the votes and power behind it for more people on Medicare, more people on Medicaid, as you mentioned, lower reimbursement rate. So when those practices try to offer a service and they have more and more customers, a greater percentage of their patients coming through the door with a lower reimbursement rate, they're not going to be able to survive long term. What is going to help them long term is more options, more market forces, more patients coming in, being able to access care, have options, and downward pressure on prices.
Yeah, Dennis, I got to say, I listened to Donna talk about this and referring to them as small businesses, and yes, to some extent that they are. But this is different from a bar or a bowling alley or a restaurant or something of that nature. These people are providing for our health care. Doesn't that make a distinction so far as being willing to make sure they survive?
I think it's a distinction that has a profound impact. Small businesses aren't going to be able to keep in business if they don't have healthy employees to help them run it. And they don't have their health to run it, the small business owners. These doctors are forced to accept a rate by the government.
And the insurance companies.
And the insurance companies. It's one that's not sustainable. These are the people that are keeping our people healthy enough so they can be have their jobs and go to work in the economy. And I think it's counterproductive if we try not to help them when we give billions of dollars to these billionaire companies out there for payroll, and we don't help the people that are helping our people stay healthy. It just makes no sense to me, Tom.
Donna, a lot of these folks have been forced into telemedicine because of restrictions and so forth. Like the patients don't come in. I heard one doc say, you know, we make our living with butts in the chairs. We make our living by having people where we can examine them and treat them. And this telemedicine just isn't helping. And so far as the insurance companies are concerned, all the insurance companies, they're not getting reimbursed adequately enough. Should those rates be increased?
look, I think that it should be up to a doctor or a nurse to decide how much they want to embrace telemedicine, and that depends on...
They don't have any choice about this, Donna.
Well, in some cases they do. Sure, they could simply tell a patient, look, I can't, with your ailment that you are describing to me, I'm not able to do it via telemedicine. So I'm not sure what you mean by they're being forced.
There is such a thing as a Hippocratic oath. I mean, I'll have to tell you, I see a distinction here between doctors maybe and some of these others, but I hear what you're saying, and I think you're making some good points in general about small businesses.
Well, remember that for me, as I look at COVID-19, I see really two aspects of COVID-19. One, certainly the public health situation, but I believe that this is also an economic health situation. So I understand your argument about that these are frontline workers, et cetera, but they are small business people. And once again, I just feel like the other industries that are impacted severely, already people have lost their jobs, already bad financial circumstances for them. They always seem to be pushed to the side and not enough discussion of them. And so I want to be a voice for those people as well, because the people on the front lines, they have plenty of public voices.
I hear
What
you.
about the people who don't?
Yeah. Well, and I agree with what you're saying to an extent, but I ain't going to a bartender if I got a sore throat. Well, thanks for watching the After Spin. We've got more video all during the week on ncspin.com.